Welcome back. This year, Gundersen Health System celebrates 40 years of nurse midwifery services, making it the longest program in Wisconsin.
And joining us this morning to discuss those services, Amy Belling-Dunn. Amy, thanks for joining us this morning. Talking about 40 years of this service at Gundersen, how important is it to you to be a part of this?
It's really great. We're the oldest running nurse midwifery service in Wisconsin, and to be part of such a well-established, long-running service is really amazing as a midwife.
Tell us a little bit about exactly what a midwife does, how they're different than a normal service at Gundersen, seeing a normal doctor.
Sure. So certified nurse midwives, we are all trained as registered nurses, and then we go on to get either a master's degree or a doctorate to be midwives. We provide healthcare services to women throughout the lifespan, so through adolescence all the way through menopause. We offer family planning services, preventative health services, and we also do a lot of prenatal care, and then we're there with women throughout their labor and their birth.
So is that sort of familiarity, being there with a woman throughout her life, so to speak, kind of the reason why people choose midwives over doctors as far as the birthing process goes?
Sure. You know, midwives were trained as nurses, so we do have a bit of a different philosophy of care than physicians do. We also really focus on the normalcy of pregnancy and birth, and we see it as a normal part of a woman's life, that women's bodies are meant to be pregnant and to have babies. And then we do spend a lot of time focusing on education. We spend a lot of time doing labor support with women during their births as well.
So what's, I guess, the difference in the delivery room, having a doctor there as opposed to a midwife?
Yeah.
Is there anything significant there?
Sure. So really, midwives take care of women that are normal and healthy, and physicians really can specialize in more high-risk type of births and deliveries and things like that. We do spend a lot of time with a woman during her labor, giving her a lot of support and things like that.
Right, so if something does kind of get over the scope of the midwife, a doctor will step in and help out and do what needs to be done.
Yeah, exactly. We work really collaboratively with the physicians, so they are there in case of an emergency. If a woman needs a cesarean or something like that, they're there to back us up.
Yeah, nice to have all those services
under
one roof there at Gundersen. And
Yeah.
Amy, thanks so much for joining us this morning.